Marla with 9 Health, and we are here presenting our Health Happens today that we do every Tuesday at 11. Last week we talked about a very important clinical trial that helps those with severe epilepsy. So if you missed that, go ahead and check it out on our Facebook Live, our Facebook page, 9 Health Fair. But today we are here at Golden Triangle Auto Care, and you may be thinking to yourself, what does that have to do with health really? And so we're going to find out. We've got our guests today, Dr. Taman Osborne Roberts, and we also have David here from the Golden Triangle Auto Care, and you're a licensed mechanic. Why are we here? What does health have to do with cars? What is the correlation?
Well, a lot of people think that their car's getting sick, maybe I should get it checked out to see what's going on with it, right?
Right.
Same with the way we think about doctors.
That's right.
Yeah, I'm not feeling so good, maybe I should go see the doctor. It all kind of has a correlation about how things function and move on.
That's right, and maintenance. The only difference is your car has a maintenance light to tell us when to come in. That's how I know to come in anyway.
Yes, the maintenance light is good for telling you that, hey, something is going on with the car, and it helps a lot of people, but there's also noises, creaks and groans. You feel different things sometimes that the check engine light doesn't tell you that it's there, but a lot of people ignore a lot of that stuff until it becomes a bad problem.
That sounds familiar about health too. So maintenance is very important for your car, just like it is for your health. Now I know we interrupted your work day, so we're going to let you go ahead and get back to your work.
Thank you.
And we're going to talk to Dr. Taman, okay?
Alrighty.
Thank you so much. So, is he right?
He is absolutely right. A body really isn't all that different from a car. It has pipes, it has fluids, it has pressures, it has parts. You need to put fuel in it. But same as with a car, parts wear out. If you put too much of the wrong fuel in, you'll gunk up the system. And even if everything is going well, honestly, you just need to have it checked out every once in a while. So you come to your body's mechanic, your doctor, and we take a look at things for you.
But okay, so seriously, the car does have kind of some lights and indicators that you need to get maintenance on a regular basis. How do you know when it's time to go to get your body maintenance and get screened and go see someone like yourself?
Well, really, most of us have our own type of a check engine light, inside of us. There's just this little feeling that most of us will get when we know something isn't quite right. Maybe there's an ache or a pain we haven't taken care of. Maybe there's, some change in our body that we've seen that's different than it normally is. We notice these things. The main thing is, do we listen to that little light that comes on or not?
Do we ignore it?
Do we ignore it? And a lot of us do. And men in particular will drive a car past the time that light has come on.
And by car, you mean human body.
I mean human body. So it's important to pay attention to those things. And if at least give your doctor's office a call if you really are concerned.
And today we are here to talk specifically about men's health. And so if you have questions about that, go ahead and type them in. We will try and take your questions and answer your questions. And the reason we're talking about men's health today is because evidence will show, studies show, that men are less likely to go get preventive care than women. So why is that? Is that true, first of all?
Yes, absolutely. It's true from the research. It's also true from whatever I see in my practice all the time.
You can vouch for it, right?
I can absolutely vouch for it. And I really think the reason for it is that men, we really take a lot onto ourselves. We kind of tend to take this attitude that in life, I got this, I can do it, I'm a man. We really feel that way.
Okay, so it's a manly thing.
It's a manly thing, it really is. But at the same time, what I like to tell the men that I know in my life, and in addition to that, the men that come in to see me as a patient, is I'm really happy you're here because you are actually really being a man right now. You're taking on responsibility, not just for your own health, but for all the people that you take care of, whether those are spouses, whether those are family members, kids, your co-workers, all the people that depend on you to stand up and do what's right for you by taking care of your health, you're making sure you can be there for them.
So actually making it manly to take care of your health.
Absolutely, and it is. It really is. Take responsibility, take control. It's your health.
Right. And so what would you say to women? Most men have some women in their lives, right? A sister, a mother, a significant other. What would you say to women out there? How can you encourage the men in your life to take care of their health?
Well, a lot of times we talk about the stick or the carrot. I say beat them with the carrot.
Okay, wait a minute. You're going to have to explain. Beat them with the carrot? Okay, go ahead. Explain that.
So really do as much as you can to encourage them to get in.
Okay.
For the reasons I just said, remind them, I'm in your life, I need you here, I need you to help take care of me. We're a partner, we're partners and this is a partnership. This is a way for you to help take care of me.
Okay.
But the other thing, you can do at times is, to try and turn the entire thing into something that's more enjoyable. So
Okay.
especially if you can get an appointment in the afternoon, say, honey, if you make this appointment in the afternoon, if you're, say, someone's
say, it only
significant
works if
other,
you're a significant
only works
other.
if you're a significant
Yeah.
other, but you say, let's have a date night after this. We'll go, we'll
Very
get a
nice.
checkup, we're going to go out for a special night, it'll be great.
It's like a bribe almost.
It's, I wouldn't use that term, but yes.
One
bit like
might
that.
use that term.
One
Okay.
might use that
Okay.
term.
Okay, very good. And so that's important, is first of all, getting men engaged in their own health care.
Absolutely.
Yeah.
Absolutely.
And one of the things that we talked about earlier, and I was so fascinated with, is that you are in family practice, and so this is kind of what you do.
Absolutely.
But not only that, you work at Clinica, and you are helping people every day really do access care.
Absolutely. So I work at Clinica Family Health Centers.
Yes.
There's
A
a
great
few
place.
few different locations that happen to be all throughout Adams County and Boulder County. And I've always worked in health centers like that because everyone needs a good doctor. Some people may not have as much access. They don't have
That's right.
time or money or various other things that prevent them from getting in. And the
Right.
type of place I work helps people to be able to access that care.
That's
because
right.
everyone needs a good doctor.
That's right, and that's important. So sometimes one of the reasons maybe we don't access care is because it's going to cost us money. And so it's nice to know that there are places you can go, the clinics and some of those things that are a little bit less expensive and you can actually afford.
Absolutely.
So, because everyone does need it. Okay, really great. Well, again, we're here with Dr. Taman, and we are talking about men's health. And the reason we're at Golden Triangle Auto Shop here today is because we feel like, and you're telling us, that the body is a lot like a car. The only thing we're missing is that check engine light. Except you're saying we have it. We just don't listen to it.
Absolutely.
Okay.
Most of us have that moment in a day if something is going on when we notice it. Whether it's a little creak in a joint, whether it's just something different on our bodies that we didn't have there before.
Yeah.
There is a check engine light. The question is, do we ignore it or do we listen to it?
Very good. Okay, so we want to encourage people to listen to it.
Absolutely.
Now, let's talk about some of the common things that men should really pay attention to when we're talking about this prevention. What are some of the things that you would recommend that men take advantage of in terms of prevention?
So there's a number of things that men, and anyone really, but men can really do to help take care of their health.
Okay.
The first is to make sure that you have regular exercise. Very important. In addition to that, eating well, and in addition to that, getting enough sleep. Those three things alone can cure or prevent a whole range of problems.
Gosh, yeah, and
But-
that's easier said than done, but it is so important.
It's hard. It's really hard, and we get that. But let's say something has gone on. What do we most commonly see? Things that really tend to affect men that come in to see me tend to be diabetes,
Okay.
high cholesterol, high blood pressure. And these are all things that with the regular preventive health visits we can detect, and if we find them early, we can treat them. Oftentimes by just making changes to those other things that I just talked about. But if somebody needs medication, catching something earlier can mean that they need less medication, or that eventually we can work to get them off the medication, rather than catching it late when things are much more severe.
Yeah, so important and well said. At Nine Health, we really believe in this prevention, and that's why we do health fairs all around the state in the spring and the fall, and we offer some of those screenings, cholesterol,
Absolutely.
and diabetes that you mentioned,
And blood pressure.
and blood pressure, right. And so some of those screenings that would be very important, and you could bring to your provider, and then you
Absolutely.
could have that intelligent conversation and talk about the engine and the lights and how to prevent this. What about prostate cancer? That seems specific to men.
And it is very specific to men, and very, very important to have screening for.
Okay.
The current recommendation is that all men, starting at age 50, have a screening for prostate cancer.
Okay.
There are two ways to do it. One is a lab test called prostate-specific antigen. It's a blood test.
Okay, we offer that at the health fairs.
Indeed, which is fantastic.
Yeah.
And another way to have it is via having an actual exam of your prostate, which is an exam that your doctor would do in the office.
Okay.
Either one works, and you can certainly get either one, but really on a yearly basis, it's important for men to really discuss that with their doctor and the results and what it means.
And there are some cases where you'd want to check that before 50. So, you want to have that conversation with your provider.
Absolutely. Some men are high risk. I myself actually, come from a high risk standpoint.
Okay.
It's a family history of prostate cancer, certain racial backgrounds, other things make men high risk. So it's important to check with your doctor long before 50 to ensure that you're getting all of the right tests done.
Right. Very good. And those tests, those screenings have been somewhat controversial, so it would be really important to have a conversation with your provider.
Absolutely.
So that you can understand what you want to do.
Exactly.
Decision, yeah.
Exactly.
Yeah. Okay, so again, we are here at the Golden Triangle Auto Care and Maintenance Shop, and so the reason we're here is because what we're talking about is men's health, and we're talking about to Dr. Taman about how the human body is much like a vehicle, a car. And so if you have questions for us or want to comment, please go ahead and type those in, and we will try and get your questions answered. Now, something that we talked about a little bit, and how do you engage men in really taking action on their prevention and their health? And one of the things that we know they care so much about is kind of like the sexual health and maybe testosterone. And is there any tie to that in your general overall health?
So overall, one of the things that we tend to see men do is to come in when they think there's some sort of a problem. And
Right.
oftentimes they'll say, well, maybe it's related to low testosterone. We will see low testosterone on occasion in men, and men will oftentimes come in thinking that that's the cause potentially for a problem with sexual health. But what we see a lot of the time is that there's another underlying condition, is that there happens to be diabetes, which can affect a man's ability to get an erection. We'll see the same thing from smoking.
Okay.
We'll see the same thing from a whole range of other conditions. And as we begin today, we find out what's really going on.
That's
we find
important.
out the actual thing that we need to treat.
That's important, right? So very good. And again, I think that whatever it takes to have men engage in their health, we at Nine Health offer that testosterone screening just because we know that's a good way. That's to capture the interest of men, and then they can have a better conversation with their provider about what is really happening, and can you help me understand a little bit more. And that's your opportunity to talk about maybe it's cholesterol, maybe it's diabetes. Okay. Do we have questions?
Question about men's heart health. Is that any different than women's heart health?
Oh,
Is there
very
anything
good.
else they
Very good.
should be looking for?
First, I have a trick question. What part of the car would you say is like that in a heart in a human? What's the heart of the car? Would it be the engine, do you think, or?
If I had to come up with something, I'm going to say,
You're not a mechanic,
I'm
right?
not a mechanic. So
Good thing you know a lot
we'll
about
let the
that.
experts talk about that. We'll get together. We'll have a conference.
I knew it was a trick question. But what about men's heart health? Is that different? What would you say to men about what you should be doing about your heart health?
So both men and women need to pay attention to their heart health. With men's heart health, what we do tend to see is higher risk starting earlier for men in their hearts.
Okay.
And we will also tend to see, and this is backed up by research, that men will ignore a potential heart problem.
Okay.
Like they will ignore many things in their health for longer, which means that they may come in when they're having real issues.
Yeah.
So really, to take care of heart health, it's a lot of the things I talked about previously. Exercise, good diet, and most doctors in their offices can advise you and even help you with that. And there are whole doctors' offices related just to helping you with that.
Right.
But all of the typical things you think about, but also cholesterol. And the only real way to know what your cholesterol looks like is to actually come in and have it checked.
Yeah.
So, a very, very important reason to visit your doctor.
And that's a good point. I mean, I keep hearing you say, don't ignore these little things that you think maybe just are normal, everyday things. What is your advice? How do you know when it's just like, an ache and pain that's normal, and how do you know when, hey, I need to go see a professional, a provider?
So I think most of the time, and just about all of us, there's this internal little voice that, says you're telling yourself the truth, or you might be fibbing to yourself maybe just a little bit. And when something happens, most of us know whether or not it's truly something that, oh, this is fine, the Tylenol that I have in my medicine cabinet will take care of this, or this is not normal.
Okay.
When it's the second one, give your doctor's office a call. Ask to speak with somebody and say, I have this going on, what do you think? Sometimes they're going to say, no, that's okay. Stay home and handle it this way, and this is the best way to handle it. And we get calls like that all the time, and folks that we give ways to take care of at home and on their own in really simple ways. Other times,
That's
we'll go,
important.
it is very important.
Yeah.
But there are other times we'll go, from what you're saying, it might not be anything big, but I can't guarantee that. So come in, let's have a look-see, and let's make sure, and you'll get peace of mind. Or if there's, if it is something you can handle on your own and not a big deal, or if it's something that you need more care for, at least you know, and you're in, and we're taking care of it.
Yeah, really great. That's a great way to kind of wrap it up. So really, there's certain things you can do on your own, which is nice to know, but there's also certain things at times when you need to go see a professional. Someone like yourself.
Yeah, again, much like a car. You can wash your car on your own. You might even be able to change the oil with enough skill. But I wouldn't advise you to necessarily on your own change out a transmission.
Okay, yeah,
Unless you're a
definitely
mechanic.
not.
And even if you're a mechanic, you might want to have your friend do it.
Yeah. Very good. Okay, really great. Thank you so much for joining us and giving us this information. We're talking about men's health. If you still have questions, you can go ahead and type them in, and we'll try and get to those questions. But in the meantime, we're going to go ahead and sign off. Thank you for joining us, and we will see you here next week. Thanks so much. Yay. Great job.
Very nice. Very good. There's not many questions.
Thanks for letting me ask you the testosterone question.
Are there
I
any
think you did
questions?